Hello and greetings from the United Kingdom. My name is Dr. Kieren Bong and I'm a cosmetic doctor based in Glasgow, Scotland. Many of you may already be aware that I'm one of the pioneering doctors who helped develop the babyGLOW treatment protocol by Teoxane, and on the 29th of January 2026, I had the privilege of taking part in the global launch of babyGLOW at IMCAS Paris. IMCAS Paris is one of the world's largest and most prestigious conferences on cosmetic medicine and surgery. And this year, over 20,000 doctors, surgeons, and industry professionals from over 100 countries convened in Paris to share and learn from some of our industry's most respected experts. For many years, facial rejuvenation has often been dominated by approaches that focus on shape and structure. babyGLOW is different. It places skin quality at the center of facial rejuvenation. And that shift is exactly what makes it so powerful. And the truth is, when skin quality improves, everything looks better. The face looks fresher, the complexion looks healthier, the features look more refined, without looking done. babyGLOW didn't appear overnight, and it certainly wasn't created in isolation. This protocol was born from an intense collaboration between Teoxane's internal scientific and medical departments and a small group of doctors who were invited to contribute to the development of a new technique, one that could deliver a very specific outcome, a consistent, optimized glow effect with natural-looking results. That process began back in 2024 at IMCAS Paris, when 6 doctors from Poland, Germany, Israel, and the United Kingdom, including myself, met with Teoxane's internal teams. We weren't there to discuss a marketing concept. We were there to build something clinically meaningful, a technique with reproducible outcomes, a clear protocol, and a strong anatomical rationale. We tested, we refined, we challenged assumptions, we optimized injection points, depth, spacing, product behavior, diffusion, and results. And what emerged from that work is what you're now seeing as babyGLOW. So for me personally, being part of the global launch at IMCAS Paris in January 2026 was a real honor. And I would now like to share with you the video recording of my lecture.
Today, I'm joined by a stellar faculty, and I'd like to invite them onto the stage. For the first part of the symposium, I have Dr. Kieren, Dr. Sylvia, and Professor Violetta. This is the global launch of babyGLOW. Cue the video. To kick off babyGLOW, I'd like to take the opportunity to introduce on stage Dr. Kieren Bong.
Thank you very much, and a very good afternoon to all of you. I feel very proud and immensely honored to be one of the pioneers in the journey of babyGLOW injection protocol, and at this very moment, participate in its global launch, speaking alongside some of my most esteemed colleagues. Let us start with the word glow. The word glow is increasingly becoming the universal language to describe skin quality. When we say somebody is glowing, we indicate more than just surface gloss or shine. It tells us a lot more than what goes on beneath the very surface of the epidermis. We know that our priorities change when we age. We used to always think that only older people who have evidence of photo damage can benefit from skin quality treatments. But we are seeing a shift in this pattern, so much so that young people, at 66% of those between the age of 24 to 29, are interested in skin quality treatments. So skin quality and the desire to have good skin quality is a cross-generational desire. We also have seen on a day-to-day practice that 77% of our patients who are interested in injectables are also interested in having good skin quality. And a whopping 94%, which is the vast majority of our patients, desire to have a radiant, healthy, and glowing appearance. Broadly speaking, currently, skin quality treatments are divided into two categories. There can be the non-injectables, for instance, the LED therapy, the microneedlings, the microdermabrasions, or some clinic-based skincare products, or the other injectables, such as the biostimulators, the skin boosters, and other regenerative therapies. But irrespective of whether they are injectables or non-injectables, there are a few challenges that clinicians have to consider, and some of these factors can potentially be barrier to the uptake of these procedures. Many of these procedures can be overly complicated to perform. Many of them do not have a standardized treatment protocol, and therefore one clinician does it one way and another clinician does it a different way. Many of them are quite time-consuming to perform, and many of them are associated with variable downtime. And also we know that many of these procedures are also associated with some discomfort during the procedure. How many of us in our day-to-day practice have seen that our patients are interested in skin quality procedures, but the first thing they ask is if it's going to be painful during the procedure, or if they are going to be able to return to their day-to-day activities, such as going back to work, or seeing their friends and family for dinner in the same evening. Introducing a new signature skin quality treatment protocol by Teoxane. This is not just any injection technique. It all started 2 years ago here at IMCAS in 2023. It is an injection protocol conceived after 2 years of very intensive collaboration between Teoxane's internal scientific and medical teams and a group of some of Teoxane's most trusted expert doctors. 2 years of process, this small committee worked incredibly hard analyzing the behavior of some of the active ingredients within the product, within the skin, its diffusion pattern within the skin post-injections, and very importantly, the optimal injection depth and placement of the product required to achieve a consistent, safe, and effective clinical outcome. And these expert doctors come from numerous parts of the world, including doctors from Germany, Poland, Italy, Turkey, Israel, and the United Kingdom. And the injection technique has been validated by even more doctors from different parts of the world. And it is delightfully straightforward, that consists of only 4 anatomical landmark lines with 8 carefully chosen and validated injection points to ensure a consistent, safe, and effective clinical outcome. And it utilizes one of Teoxane's most popular products, the Redensity 1, a very well-established product that's been around since 2012. And we know that Redensity 1 comes with a catalog of benefits, some of which are that it provides you with superior hydrating effect, a robust antioxidant action, and a clinically proven biostimulatory properties for skin redensification. And how does Redensity 1 achieve all of that? The babyGLOW injection protocol utilizes a 3 cc Redensity 1 syringe, and within the syringe there is a whopping 45 milligram of high molecular weight hyaluronic acid, giving you a superior hydrating effect. And Redensity 1 is unique, as we know, that it has a concoction of 8 amino acids, 3 antioxidants, 2 minerals, and 1 vitamin. Singularly, these active ingredients don't do very much, but when they are put together as a complex within a syringe, they work synergistically with each other, providing you with robust antioxidant action as well as clinically proven biostimulatory properties. How does Redensity 1 achieve all of that? We know that Redensity 1 is capable of inducing strong redensification of the papillary dermis. It also strengthens the dermal-epidermal junction, and clinically that translates into an increase in elasticity and skin firmness. We also know that glycosaminoglycans are very important when it comes to dermal and epidermal hydration. And Redensity 1 has shown that it is very capable at stimulating the production of glycosaminoglycans within the epidermis. And clinically, this translates into a significant increase in epidermal hydration. And the dermal restructuring complex within Redensity 1 has also been shown that it is capable of strengthening the dermal-epidermal junction, and again, clinically, this translates into increase in elasticity as well as skin firmness. And finally, Redensity 1 is capable of stimulating the production of fibrillin 1 at the dermal-epidermal junction, and again, clinically, this translates into an increase in tensor effect, which means when you touch the skin feels smoother. What about the injection depth of Redensity 1? You may ask. Historically, Teoxane advocates the placement of Redensity 1 intradermally. But when it comes to babyGLOW injection protocol, Teoxane advocates the placement of Redensity 1 in the subcutaneous layer. And to achieve a consistent, safe, and effective clinical outcome, Teoxane advocates the use of a 4 millimeter hypodermic needle. And because of the very fine nature of this instrument, Teoxane encourages you to use 1 needle per hemiface. What about the use of the instrument? This is a busy slide, but the question you're likely going to have is, are we going to inject perpendicularly into the skin or at an entry angle, and what that angle might potentially be? If I could divert your attention to the far right of this slide, as you can see, broadly speaking, these are some of the depth of the different layers of the skin that I would like you to keep in mind. And broadly speaking, that the epidermis is roughly about 1/4 to 1 millimeter in depth. The dermis is between 1 to 2 millimeter in depth, and the hypodermal layer is roughly about 2 to 3 millimeter in depth. Knowing that, if you were to be using a 4 millimeter hypodermic needle and you are injecting perpendicular directly into the skin, there is a risk that you might be placing the product intramuscularly. And we don't want that. But we also know that there are different thickness of the skin within the face. So what about the angle of entry when you are injecting? Later, in the second part of this presentation, Dr. Caboni is going to play you some videos of the injection technique, and I will need all of you to pay extra attention on the angle of entry, because out of the 8 injection points, there will be 3 that we would like you to inject more superficially. And the notion behind that and the rationale behind that will be carefully explained by Dr. Caboni. But broadly speaking, if it's a thinner part of the skin, you would like your angle of entry to be 15 degrees. And if it's a thicker part of the skin, the angle of entry that you will take will be 45 degrees. What about the question regarding the fact that historically we would place Redensity 1 intradermally, but now with babyGLOW injection protocol, it is subcutaneously? Are we going to compromise on the quality of the result? The answer is no. This slide showcases measurements taken with high-frequency, high-resolution ultrasound device, with the placement of Redensity 1 in the midface subcutaneously with a 25-gauge 50-millimeter cannula. Immediately after, and within 3 weeks after the injection. And this study showed that on the left side of the face, there is an increase within 3 weeks post-injection subcutaneously with the cannula, a whopping 92% tissue density. And on the right side, there was an increase by 94% tissue density, giving you an average of an increase in tissue density by 93%, which represents a very significant improvement. When it comes to introducing a new injection protocol, it is an equation that consists of two parts. There is the clinician, like us, delivering the procedure, and there is the patient themselves receiving the procedure. So what do our colleagues say after having the opportunity to try babyGLOW injection protocol? And I personally can attest to these results, that you, when you start offering this procedure, will find that it is delightfully straightforward to perform. You will get a significant satisfaction rate, and you will personally notice a tangible, noticeable improvement in the skin quality of your patients, as well as the physical appearance of it. And it comes with virtually no downtime. But what about our patients? And again, I can attest to all of these results. In fact, in my clinic, I scored better than this. All of my patients were pleasantly surprised by how impressive the results were. They were all extremely satisfied. They would certainly recommend the procedure to their friends and family. All of them noticed a tangible, noticeable result within days of the procedure. And again, they did not feel it was uncomfortable at all. When you put all of that together, does it give you, the clinician, and the patient, the wow factor? The answer is a resounding yes. And would our patients do it again? And once again, it is a resounding yes. So in summary, babyGLOW treatment protocol is not just any treatment protocol that was formulated over a kitchen table. It is 2 years in the making, a close collaboration between Teoxane's internal scientific and medical team and a group of some of Teoxane's most trusted expert doctors from different parts of the world. It's been validated, it's been confirmed to provide you with a safe, consistent, and effective clinical outcome. And it is delightfully straightforward, consisting of only 4 anatomical landmark lines, and finally, 8 very carefully chosen and validated injection points. Thank you.
Thank you very much, Kieren, for that amazing presentation.